Hello everyone, welcome back to my channel. Today I'm going to talk about my top 5 procedures that I like to do in my clinic for anti-aging. Part 1 of this video, which is recorded earlier, talks about the things that you can do in your home, and these include lifestyle and skincare tips. So my name is Dr. Swati Cannon. I'm a double board certified dermatologist, skin cancer surgeon, and a cosmetic dermatologist in California. First, let's talk about the aging process briefly. Physically on the face, aging is characterized by bone loss, muscle loss, fat loss, displacement of fat pads, collagen loss, elastin loss, and overall skin loss. So really everything just kind of gets lost. And what ends up happening is that a younger face, which has this upward triangle, turns into an aged face characterized by a downward triangle because things just kind of sag and droop due to all of these losses and gravity. Anti-aging procedures using lasers usually target the upper layers of the skin. So that targets the dermis, which has collagen, and the epidermis, which is where you see the sunspots. Dilated blood vessels usually come up right underneath the epidermis. No device really creates more bone or builds more muscle, and you can do all the facial yoga that you want, but you're not necessarily going to create more muscle in the face. Facial muscles are very different than normal muscles on the body. If anything, we use Botox to weaken muscles in a very judicious fashion so that the appearance of wrinkles is minimized. So be careful of the things that you see and read on social media. Not everything is accurate. Now, I am not against other non-Western methods, acupuncture, Eastern medicine, yoga, all of those things do have their benefits, but you just need to be careful. And if you don't have the right understanding of how the aging process works, you might be worsening the process. So let's get into it. The number 5 procedure is microneedling. Microneedling done in an office is very different than the derma roller that you buy on Amazon. The derma roller does create channels into the skin, but it drags because it rolls on the skin, and that's creating microscopic injuries and tears that's going to lead to scarring, inflammation, irritation, and just not the things that you want. Microneedling that we use, the device is like a little pen. It has little needles in it, and we can control the depth of the needle penetration based on what we're targeting. So if I'm doing skin resurfacing, my needle penetration is going to be a little bit shallower versus if I'm targeting scars or deeper lines. Microneedling in general is a more cost-effective procedure compared to just lasers alone, and that's because microneedling in general is a cheaper device compared to a $200,000 laser. With microneedling, you need treatments every 3 to 4 weeks for a series of 3 to 4 treatments, depending on what we're targeting. Sometimes we also combine microneedling with PRP or platelet-rich plasma. Platelet-rich plasma, we take that from your blood, and it contains a whole bunch of growth factors. And some research is showing that when we combine lasers and microneedling with PRP, the PRP helps to heal faster, and it helps to stimulate more collagen than just the laser or microneedling alone. PRP by itself doesn't really do much. So that vampire facial that you saw all over the media at one point, where we took the blood and injected it underneath the skin, that doesn't really do much. The reason microneedling helps is because it creates tiny little microscopic channels into the skin. These channels are surrounded by normal skin, and when the injury is created, the normal collagen surrounding these channels helps to stimulate more collagen, thus causing skin texture refinement, improvement in superficial fine lines, and improvement in superficial scarring. I do not think that microneedling is as good as some of the other treatments that I'm going to talk about, but it's definitely cost efficient, and it's good for all skin types and skin colors because there's no heat, so there's less risk of discoloration. But as always, you want to go to the right provider because with any of these things, we can definitely cause harm. There are risks, and you want to go to somebody who knows how to use it. Procedure number 4 is a radiofrequency device. So a radiofrequency device basically generates heat in the deeper layers of the skin, and that heat causes collagen production. You can also have radiofrequency combined with microneedling, and these devices are like Morpheus 8. The thing that goes on the skin, the applicator or the handpiece, contains little micro needles. These needles then get punctured into the skin, and the needles release heat, thus causing more tightening. So not only do you get tightening because an injury is being produced, you're also getting tightening because of the heat that is applied to the surrounding tissue planes. I really love radiofrequency devices. They can be painful, and I think that's the downside, because heat in a deeper tissue plane, as you can imagine, doesn't feel very nice. So we definitely use anesthesia. We use something called Pronox, which is like nitrous oxide or a form of laughing gas to help ease some of the pain. This is not the same though as doing a surgical facelift or a surgical neck lift. So when you come in and you're like, I want this. Well, these tightening devices don't do that. We do have a new device that was recently approved, I believe in 2021, which uses microcoring technology. So microcoring is a newer form of technology that uses hollow needles to remove microcores of both the dermal and epidermal tissue, and it removes pretty deeper layers of tissue, causing more collagen to build and causing a much deeper level of tightening than the current devices that we have on the market. The company claims that there is no scarring that's being produced, which is good. We don't want the collagen type 3, which is the scar collagen. We want the normal type 1 collagen. This is a very new device. I actually don't know really anyone in my surroundings that has it, so I'm waiting to find out more, but it holds a lot of promise. Procedure number 3, intense pulse light or IPL. IPL is not technically a laser, it is a light-based device, and we use certain filters to filter out a specific wavelength to target a particular skin issue. So I mainly use it for patients who have sun damage characterized by reds and browns on the skin. So these patients tend to have broken blood vessels around the nose or on the cheeks, sunspots, and uneven skin tone. I find that a series of 3 to 4 treatments are usually needed, and these are spread every 4 to 6 weeks. And because IPL also produces heat, it does help to give a more refined skin texture. It doesn't really cause tightening, but I notice that the skin does look smoother once the treatments are completed. And most patients, because they continue to get sun damage, because you still have to go kind of live your life, they usually need a maintenance treatment every 6 months to every year. The one caveat for IPL is that it's limited to the lighter skin types. So I'm considered a skin type 4, and I do not use IPL on patients with my skin type or those who are darker than me, just because there's a higher risk of skin discoloration. Procedure number 2, Botox. So Botox is a trademark name. There's many other kinds of what we call neuromodulators called Dysport, Xeomin, and Juvederm. These neuromodulators are basically molecules that we inject into the muscles of the face, or we can technically inject it into any muscle, and it just weakens the muscle for a brief amount of time. So for aging purposes, we use Botox in areas of dynamic rhytid formation, meaning in wrinkles that are caused by movement of your muscle. So this usually includes the crow's feet around your eyes, your smile lines, not these smile lines, but these smile lines. We inject it into the 11s, into the forehead lines. We can do it here in the corners of the mouth to make a downward resting bitch face turn into a better looking, more upturned face. We can use it to reduce a gummy smile, to evert the lips so that you have more of a pout, for the cobblestoning that happens in the chin. And we can even do it along the masseters to help with bruxism or grinding of the jaw. It also helps to slim the face sometimes. So Botox, we can use it for so many things. People also use it for migraines. I do it for patients who have Bell's palsy. It's one of my favorite treatments. And I have noticed that patients who get little amounts of Botox throughout the years, they tend to look a lot smoother and they age much better than their counterparts who do not. Unlike muscles in the rest of your body, facial muscles are inserted directly onto the bone. So when we inject Botox into the muscle very judiciously, we decrease the shear stress the muscle produces on the bone. And theoretically, over time, we tend to then have less bone loss, which is correlated with all of the tissues drooping as we get older. On the other hand, though, if you inject too much Botox, you can get pretty bad muscular atrophy For example, Nicole Kidman had that classic muscle atrophy or muscle loss along her forehead, which looked really weird. With all of these treatments, you want to use it in a manner that still maintains the natural aesthetic. And that just slows down the aging process a little bit, but not to the point where you start to look abnormal. And finally, my favorite procedure that is anti-aging is fractional laser resurfacing, FLR. Fractional laser resurfacing is similar to microneedling in that tiny microscopic columns of injury are created into the skin. The laser, though, also has heat, and anytime you have heat in addition to injury, you're going to have more collagen stimulation. With these devices, we can control the density of the microscopic columns as well as the depth or the penetration of these microscopic columns. And fractional laser resurfacing is a general term that is utilized by a lot of different devices, but commonly we have two main kinds. So we have the ablative fractional laser resurfacing, which means that the top layer, the epidermis, is vaporized with the treatment. This is usually a stronger treatment, a treatment that we say one and done, meaning that the recovery is much longer, but most patients just need this treatment once to help with their wrinkles, fine lines, skin texture, etc. This type of treatment, though, has a higher risk of skin discoloration and post-inflammatory hyperpigmentation, and even a higher risk of scarring. So we limit this treatment to lighter skin patients. Don't usually do this on darker skin patients unless they have acne scars, and then we really control the settings to treat the darker skin patients. The other kind of fractional laser resurfacing is called non-ablative, meaning that the top layer is not vaporized off. This type of resurfacing is better for darker skin types because there's less risk of post-inflammatory hyperpigmentation, but usually you need more than just one treatment to get the benefits that you want. So fractional laser resurfacing helps with pores, skin texture, fine lines. It can help with sunspots and causes a mild tightening effect, especially if the skin kind of in this lower part of the face. We also use it for periocular wrinkles, just because the skin is so thin, so it tends to age. It tends to actually show signs of aging first, and we can get rid of some of these fine lines that cannot be helped with Botox or other things. Now, you may have noticed that I did not mention fillers, and that is because fillers, unless they are biostimulatory fillers like Radiesse or Sculptra, most fillers contain hyaluronic acid, which is not anti-aging. Fillers are used for volume loss and volume loss only. While fillers definitely have their place within cosmetic medicine, they are so overly used now, and that is why we see all of these people running around with like overblown balloon-like faces, which look so abnormal. There's actually a name for this. It's called overfilled facial syndrome. There's also evidence now that if we inject too much filler onto the bone at one time, that it can cause a little bit of bone loss. Now, this is based off of one study, but I think it's something that we really have to be mindful of. We need to use fillers wisely, and that is why it's not my top 5 procedures. As always, with any of these aesthetic procedures, you want to see a board-certified dermatologist or a board-certified plastic surgeon who does cosmetics. There are many Groupon deals for lasers and Botox and fillers, but do not sell your one and only face to Groupon. So that is it for my favorite procedures that I like to use in my office. If you have any questions or comments, please let me know below. And don't forget to hit the subscribe button so that you can stay tuned for any more videos on skincare, hair, nails, and cosmetic procedures that I do. If you want to learn about anything, please let me know and I will try my best to make a video. Thank you for watching and have a wonderful day and stay safe.